Whitman. I'm the Executive Director of the TREX Institute, and TREX stands for Targeting Revolutionary Elder Care Solutions. It's a nonprofit dedicated to improving care for seniors and saving money for our healthcare system. And I'm here today with Dee Freeman from the Graysdale Nursing Home. It's a county nursing home in Nazareth, Pennsylvania. And I wanted to talk to Dee about dental care in nursing homes, an issue that we've been struggling with for quite some time in our nation. We have 15,000 nursing homes across the country, and dental care, unfortunately, has been a service that, for the most part, has not been addressed in the way it should be. With me today is Dee Freeman, a licensed nurse and a nursing home administrator who's had 30 years of experience working in nursing homes. And I want to ask Dee specifically, what's your experience been with dental care in terms of nursing homes and their ability to provide good dental care to the residents?
It's a challenge. Staffing is lean in nursing homes, and it's really not a priority a lot of times. And if patients can't do their own oral care, getting that care provided for them can really be a challenge, and I think it's a problem that's not handled well by nursing homes.
How about dentists? How often do you see a dentist coming into a nursing home, and are they easy to get to bring into the nursing home?
Well, years ago, they just didn't come into the nursing home at all, and it was very, very hard to find them. In the last decade or so, there's been dentists that have set up shop and worked on developing portable methodologies to come to the nursing home and treat patients. But I haven't seen the kind of quality of care that you would see in your local dental office. I wouldn't say that it would compare to that level of care in a lot of cases.
Would you say that a lot of the problem is economics, the lack of reimbursement that's available to cover for dental care?
Absolutely. That is the problem.
Right. Okay. For the last several years, you've been the administrator at Graysdale, which is a large nursing home in Nazareth, Pennsylvania, a county nursing home, 700 plus beds, I believe. And what was your dental experience there when you first took over that position as the administrator?
Well, the Graysdale Nursing Home is a little bit blessed in that we do have a clinic that has a fully operational dental suite with a chair and x-ray and all that kind of stuff, which is a luxury that very, very few nursing homes have out there. In all my 30 years, I've only had 2 facilities that had that luxury of a whole dental office. When I arrived there, they had a contract with a dentist who did come in on a regular basis and do things like treat caries and dental problems and taking teeth out that needed to be taken out, those kind of things. The bigger challenge was more the dental hygiene side of it, doing the routine cleanings and teaching the staff how to do the routine cleanings in between and learning how to keep the oral care in place all year round, not just once or twice a year when the dentist would actually see them. And typically they got seen more for a problem than for routine maintenance and care.
So at Graysdale, when you first started there, what was the dental practice available and what kind of cost did it have to the facility?
All right, well, we're very blessed. It's the second facility I've ever worked in 30 years that had a full dental suite, which is something that most nursing homes do not have that luxury and makes it even more of a challenge to care. We had to hire an outside dentist to come in, and we paid that dentist by the hour for the service that the dentist provided. We provided dental staff to help in that office, dental assistants. We paid for the x-ray equipment and the maintenance of all the room and all the supplies in the room. So it was probably between $150,000 or more a year for salary, supplies, and the upkeep of that room. And primarily the care there was more on the care and treatment of problems. If somebody had an abscess or had a serious problem that needed to be treated, it wasn't so much focused on the maintenance, like when you would go to your dentist and a dental hygienist would clean your teeth twice a year before you see your dentist. So it was more on treatment than it was prevention.
While you were the administrator and you realized what was going on from a dental care perspective, you were approached by a company called Special Care that provides dental services under a unique insurance arrangement. What was your reaction to that, and how did it compare to what you currently had in place?
Well, initially I was curious because one of the problems with getting quality dentistry is trying to get the dentists paid a reasonable rate, a fair market rate. And certainly Medicare and Medicaid, to my knowledge up to that point, didn't have a mechanism in place to pay a dentist what they need to be paid to do good quality work and to do the prevention and do everything that was needed. So when Special Care approached me, I was excited because they were explaining to me that because of research that was done by the TREX Institute, an insurance plan was now available that was Medicaid reimbursable, so the patient literally is going to have nothing out of pocket at the end of the month and can actually pay the dentist fair market value to get good quality dental care and dental hygiene and prevention, dentures, everything would be covered. So I was kind of like, things that are too good to be true must not be true, but the more we checked references and looked into the program, it was all legit. And we gave it a try, and it's really has just transformed the dental care and the oral care and oral health in our facility.
Explain further how you mean transform. What are the improvements that you've seen?
First of all, the people are there several days a week providing care, and they have a dentist there, and they're doing x-rays there. They're doing cleaning there. They have people that go out on the floors to help the nurses learn how to do oral care out on the floors and follow up, even so much as changing the people's toothbrush and making sure they have a new toothbrush every couple months. So everything that you would need for daily care, all the way up to the semi-annual care, and then of course we still have in place care when there's a problem. So it's a full range of oral care as opposed to just treating problems when they occur. And I think you're seeing more and more now things like the quality measures that you have in nursing homes are impacted by this. One of them is unexpected weight loss. And if you have bad dental care, there's a good chance, if you can't eat properly, you can't maintain your weight. And we have very, very good ratings in that area. We have very good ratings in the unexpected weight loss category. Matter of fact, we have a new problem here, and thank goodness it's not a quality measure. We have unexpected weight gain.
Yeah. Dave, I'd love to hear your thoughts on dentures in nursing homes. My experience has been that in most states, Medicaid pays very poorly for them, takes a long time to get approval for them, and it's a delay for the patients who need them now instead of later, instead of months from now. What's your experience been with dentures?
Exactly what you're saying, that getting the financial approvals is hard, getting the approvals takes a long time, and clinically it can have a devastating effect on the residents. Sometimes by the time the patient is seen and identified to need the dentures, and by the time the approval comes in and then the dentures are made, so much time has elapsed that the patient's lost so much weight that when they go to fit the dentures, they don't even fit. So the wonderful thing about special care is with the new program they have and the way the insurance works, they can actually get their dentures the same day that they're seen. So literally one day, same day service, which I've never seen that ever in the long-term care industry.
And there's no waiting, no approval process, because it's all part of the insurance program.
It's all part of the insurance program. If you enroll in the insurance program, then you're covered.
Great, great. So what do you think about special care?
I think it's a unique model that really addresses both the financial and the clinical needs of the residents and the facility. It's an absolute win-win. It's a win-win for the patient, for the nursing home, and for everybody involved. I can't imagine why anybody wouldn't want to use a model exactly like the model they're using.
Thank you, Dee. I appreciate it.
Thank you, John.
It's been a pleasure.